Hair loss is a fairly common occurrence. While it's more prevalent in older adults, anyone can experience it, including children. It's typical to lose between 50 and 100 hairs a day, according to the American Academy of Dermatology. With about 100,000 hairs on your head, that small loss isn't noticeable. New hair normally replaces the lost hair, but this doesn't always happen. Hair loss can develop gradually over years or happen abruptly. Depending on the underlying cause, it may be temporary or permanent. Hair loss symptoms. The main symptom of alopecia is losing more hair than usual, but this can be harder to identify than you might think. The following symptoms can provide some clues. Widening part. If you part your hair, you might start to notice your part getting wider, which can be a sign of thinning hair. Receding hairline. Similarly, if you notice your hairline looking higher than usual, it may be a sign of thinning hair. Loose hair. Check your brush or comb after using it. Is it collecting more hair than usual? If so, this may be a sign of hair loss. Bald patches. These can range in size and can grow over time. Clogged drains. You might find that your sink or shower drains are clogged with hair. Pain or itching. If you have an underlying skin condition causing your hair loss, you might also feel pain or experience itching on your scalp. What causes hair loss? There are several types of hair loss, some are common and some are rarer, and each with different underlying causes. Depending on the type of hair loss, it can be the result of genetics, internal causes, or external causes. Here's a look at a few different types of hair loss. Androgenic alopecia. Androgenic alopecia refers to hereditary hair loss, like male pattern baldness or female pattern baldness, and is also known as pattern alopecia, because it can happen to both males and females. It's also the most common cause of hair loss, affecting up to 50% of people. Hair loss related to androgenic alopecia tends to happen gradually. While some people might experience hair loss as early as puberty, others might not notice symptoms until their middle ages. Female pattern baldness often results in thinning all over the scalp and might look like widening or thinning around the part. It typically occurs after age 65, but, for some females, it can begin early in their lives. Male pattern baldness typically involves progressive hair loss above the temples and thinning at the crown of the head, creating an M shape. Alopecia areata. Alopecia areata is an autoimmune condition that causes your immune system to attack hair follicles, resulting in bald patches that can range from small to large. In some cases, it might lead to total hair loss. In addition to losing hair on the scalp, some people with alopecia areata lose hair from their eyebrows, eyelashes, or other parts of the body. How is hair loss diagnosed? Because so many things can cause hair loss, it's best to schedule an appointment with a medical professional if you notice any changes in your hair. They'll likely use a combination of your health history, including any recent illnesses, surgeries, life stressors, and family history, and a physical exam to help narrow down the causes. If they suspect an autoimmune or skin condition, they might take a biopsy of the skin on your scalp. This involves carefully removing several small sections of skin for laboratory testing. It's important to keep in mind that hair growth is a complex process and multiple tests may be needed to understand what is causing your hair loss. A biopsy may also be taken if it is initially very unclear what the root causes may be. They may also order blood tests to check for any nutrient deficiencies or signs of an underlying condition. What are the treatment options for hair loss? There's a range of treatment options for hair loss, but the best option for you will depend on what's causing your hair loss. Typically, the most common types of hair loss are treated with topical or oral medications, which will likely be the first course of treatment. How can I prevent hair loss? There are a few things you can do to minimize hair loss. Keep hairstyles loose. If you regularly style your hair into braids, buns, or ponytails, try to keep them loose so they don't put too much pressure on your hair. Avoid touching your hair. As much as possible, try not to pull, twist, or rub your hair. Pat hair dry. After washing, use a towel to gently pat your hair dry. Avoid rubbing your hair with the towel or twisting it within the towel. Aim for a nutrient-rich balanced diet. Try to incorporate plenty of iron and protein into snacks and meals.